Hello everybody, this is Carlos from Army of Nurses and welcome to another video. Today's video we're going to go over medication dosage calculation review. Now learning outcomes would be students will be able to apply the general formula method or they will be able to use the cross multiplication method. Students will be able to correctly identify the units in their answers. Students will be able to correctly carry out rounding, either rounding up or rounding down, and we'll go over certain scenarios. And lastly, students will be able to correctly calculate the total daily dosages of medications. Now, the general formula method includes three components: the order, which is in grams, milligrams, micrograms, etc. Supply, same thing, and your volume in milliliters. So your formula is going to be your order, the doctor's order, divided by the supply in which the medication comes in from the manufacturer, times the volume, will give you the dosage. Now the cross multiplication method, same thing applies. There's the order, supply, and volume. And for those of you who have learned cross multiplication in the past, as you can see here, we're going to go order times the volume, as you can see my arrows here, divided by the supply, hence the name cross multiplication. So therefore, if you reorganize this formula, it will look something like this: order times volume divided by supply equals to the dosage, which actually it resembles very much to our general formula. So let's talk about rounding dosages. Now, a general rule is that dosages should be rounded to the closest 1/10 when they're large dosages, and when it comes to smaller dosages, we try to round them to the closest 100. So let's go for example number 1, which is the large dose. Now our supply is acetaminophen 160 milligrams in 5 milliliters. The doctor is going to order 200 milligrams by mouth. My question is, how many milliliters would you give? Well, let's plug this into our formula. Our order is 200 milligrams. Our supply is 160 milligrams, right? And the volume is 5 milliliters. That's how the Tylenol comes in dissolved in, right? So if we do the calculation, we're going to get 6.25 milliliters. And in this case, we're going to round it up to 6.3 milliliters. Now, however, we're not going to round it down to 6.0. And the reason why is because 6.25 equals 200 milligrams. 6.3, when we round it up, equals to 201.6 milligram, which when it comes to Tylenol by mouth, the 1.6 milligram, it's it can be omitted. It's a very small dose. Now, if we ended up rounding down to 6.0 milliliters, now our dosage actually, the milligram goes down to 192 milligrams. And that's a difference of 8 milligrams. So that could be a medication error. Alternatively, if you look at the syringe, this one here is a 10 milliliter syringe, it becomes kind of challenging to draw 6.25 in a large syringe like this, which is why we round it up to the closest 1/10. Now, in my next example, we're going to use a small dosage. So our supply is going to be Humulin R insulin, and it comes in 100 units per 1 milliliter. The doctor's going to order 26 units subcutaneously. Now my question is, how many milliliters would you give? Well, let's plug this into our formula. Our order, 26 units, okay, divided by our supply, which is 100 units, times our volume. It's dissolved in 1 milliliter. And if we do our math, it's going to give us 0.26 milliliters. But in this case, we're not going to round up to 0.3 milliliters. Now, the reason being is because 26 units equals to 0.26 milliliters. If we round this up to 0.3 milliliters here, it actually will increase in the dosage of insulin to 30 units. And the 4 units of insulin is a huge difference for some patients because it is a high-risk medication, and that would be a big medication error. Now, in this example, we are keeping it in the 100th as 0.26 milliliters. Additionally, if you see the 1 milliliter syringe that I have here, right, it's easier to be able to pull 0.26 milliliters because, as you can see right here, is 0.2. Right between 0.2 and 0.3, this one right here would be our 0.25. And then the next tiny bar underneath it would be 0.26, which makes it easier to actually pull that. Now, if we do this in this big syringe, it's very challenging, and therefore with a big syringe like this, we are going to round it to the closest 1/10. With small dosages, we're going to round it to the closest 100th of a dose. Okay, so let's look at some example. Sample question number 1. The doctor orders atorvastatin 30 milligrams by mouth during bedtime. Atorvastatin comes in 20 milligrams per tablet. How many tablets would you administer? So let's follow our systematic way of doing this. Step number 1, you always identify the units of your answer. And in this case, I'm asking you for tablets. The units are always embedded in the question. So if I'm asking you how many tablets would you administer, your answer should be in tablets, not in capsules, not in any other units. Okay, so read the questions properly because part of your answers are already in the questions themselves. Step number 2, we're gonna choose our formula, either the cross multiplication or the general formula, whichever you prefer. Step number 3, we're gonna plug in our numbers and do the math. So our order is 30 milligrams, as you can see here, 30, divided by our supply, which is 20 milligrams. And in our volume, we're going to put our 1 tablet. Now, the way that you can look at this is 20 milligrams is in 1 tablet. It's included in 1 tablet, okay? It's like encompassing it. So if you do the math, it will give us 1.5 tablets. And same thing if we do the cross multiplication. Now, do I round up or round down tablets? No. The reason why is because since we got 1.5 tablets equals to 30 milligrams, if you ended up rounding the 1.5 tablets up to 2 tablets, you can see that you're actually giving the patient 40 milligrams of atorvastatin instead of 30. That's an extra 10 milligrams increase, and that is a medication error. So step number 5, our final answer would be I would administer 1.5 tablets or 1.5 tablets of atorvastatin for the patient. Now let's look at our next example, and this one includes a total daily dose in 24 hours. Okay, the doctor orders pregabalin 150 milligrams by mouth 3 times a day. Now pregabalin comes in 75 milligrams per tablet. How many tablets would you administer in 24 hours? You see how this question I'm asking you not for 1 dose, but for the whole day in total. Okay, so step number 1, same thing. We're gonna identify our unit, and in this case, I'm already telling you the units. I want tablets, so your answer should be in tablets. Okay, step number 2, this is where we're going to find out the total dose of pregabalin that we're going to give in 24 hours. So from what we know that 1 dose equals to 150 milligrams, correct? Right here. And the doctor orders it TID, which is 3 times a day. So if we order 3 times per day, that means that it is 3 dosages in 1 day. So 150 milligram, which is 1 dose, times, we're going to give it 3 times a day, so 3 dosages, it will give us 450 milligrams per day. This means that the doctor has ordered 450 milligrams in 24 hours. We're just spreading it over 3 dosages, with each dose being 150 milligrams. So we're going to use our formula. And then step number 4, we're going to plug in our numbers. Now the order, as you can see, in this case, because I'm asking for the total dose in 24 hours, you're not going to enter 1 single dose here. You're going to enter the 24-hour dose. And we calculated it was 450 milligrams. So our order is 450 milligrams in 24 hours divided by our supply, which is 75 milligrams, times our volume, which is 1 tablet. Again, 75 milligrams are contained in 1 tablet. If you do the math, it will give us 6 tablets, and if we use the cross multiplication method, it will also give us 6 tablets. Now step number 5, do I round up or round down my tablets? Again, no, and in this case with more reason, no, because 6 is a whole number. You will get 6 complete tablets, right? So step number 6, my answer, sorry, there's a little typo here. My answer was for step number 6 would be I would administer 6 tablets of pregabalin in 24 hours. And that is what the question is asking. And that's it for this video. Thank you for watching, and like and subscribe, and I'll see you in your next video. Bye for now.